Do you know that a patient can have 100% oxygen saturation and still be dying from lack of oxygen? As a nurse, you should know this. A lot of people think a normal SpO2 means the tissues are getting enough oxygen, but that's not always true. Pulse oximeters only measure the percentage of hemoglobin carrying oxygen. They do not tell you how much hemoglobin the patient has, whether blood is reaching the tissues or whether the cells can actually use the oxygen. So, a patient can have normal oxygen saturation, but the organs are still not getting enough oxygen? Exactly. Take severe anemia, for example. The saturation may still read 100%, but there's very little hemoglobin available to actually carry oxygen. The pulse oximeter may still show a normal reading, while the tissues are actually starving for oxygen. And in shock, oxygen may be present in the blood, but poor perfusion prevents it from reaching the cells properly. So remember this: normal oxygen saturation does not always mean adequate tissue oxygenation. Treat the patient, not just the monitor. A normal blood sugar today does not mean your patient's diabetes is controlled. Your patient's glucose can be normal right now, while their HbA1c is dangerously high. That's why HbA1c matters. A lot of student nurses know finger prick glucose, but don't really understand HbA1c. Let me explain. HbA1c stands for hemoglobin A1c, also called glycated hemoglobin or glycosylated hemoglobin. Let's talk about a blood test many people hear about but don't fully understand. HbA1c. A lot of people think HbA1c is just another blood sugar test, but it's actually different. A normal blood sugar test tells you what the glucose level is right now, but HbA1c, it tells you the average blood sugar over the last 2 to 3 months. So instead of looking at one moment, it looks at the bigger picture. Here's how it works. Sugar in the blood sticks to hemoglobin, the protein inside red blood cells. And because red blood cells live for about 3 months, HbA1c gives us an idea of long-term blood sugar control. So if someone's HbA1c is high, that means their blood sugar has been running high for a while. So what's the normal range? Good question. Below 5.7% is normal. 5.7 to 6.4% is prediabetes. And 6.5% or higher suggests diabetes. And for many diabetic patients, the goal is usually below 7%.
But why is HbA1c so important?
Because poorly controlled HbA1c increase the risk of kidney disease, stroke, heart disease, and nerve damage. In summary, finger prick glucose shows today, but HbA1c shows the bigger picture. HbA1c is used to diagnose diabetes and see how it's being managed. Normal blood pressure doesn't mean your patient is okay. Your patient's blood pressure can look normal, but their organs are failing. A lot of people focus on blood pressure and completely ignore MAP. But MAP is a very important number. It tells you about your patient's organ perfusion. MAP stands for mean arterial pressure. It's the average pressure in the arteries during one cardiac cycle. And it tells us how well blood is reaching vital organs. So why is MAP more important than just looking at blood pressure? Because MAP gives a more accurate picture of perfusion. MAP gives a better picture of organ perfusion. You can have a normal-looking blood pressure, but still have a low MAP. And that means the brain, the kidneys, the heart may not be getting enough blood.
So, what is the normal MAP, and when should we worry?
Generally, we aim for a MAP of at least 65 mmHg in most adults. If it drops below 65, that's a red flag. It may indicate shock, severe hypotension, or poor circulation, and it requires urgent attention. In summary, blood pressure gives you numbers, but MAP tells you if the organs are actually being perfused. In critical care, MAP is the number you don't ignore.